Hey, I'm Zoe Ferguson, and I'm going to be talking about why assisted suicide should be legal. Envision you've recently been determined to have an inoperable mind tumor, as your primary care physician sits before you informing that you have concerning a half year to live and that your demise might be excruciating and filled with extreme seizures. You keep thinking about whether there may be more nobility in death than in living the most recent days of your life along these lines. At that point, you consider how others will feel in the event that you picked helped self-suicide. Would your loved ones be strong? Shouldn't something be said about your doctor and other consideration suppliers? At long last, you inquire as to whether you could even push ahead with helping self-destruction in your state, since it isn't lawful the nation over. Countless inquiries flood your psyche. I now want to talk about the history of assisted suicide. Many people think that Dr. Jack Kevorkian started the assisted suicide debate in the late 1990s. However, another famous physician, Dr. Walter Kempster, was in the spotlight 93 years earlier. In 1906, Dr. Kempster gave a lethal dose of morphine to a woman who suffered third-degree burns that were self-inflicted. Fast forward to meet Dr. Kevorkian, a pathologist who assisted people suffering from acute medical conditions to end their lives, and you'll be met with the start of the current debate. Legal battles loomed over his actions for years before he was sentenced to prison in 1999. He spent 8 years of life in prison, but even when he was behind bars, his actions continued to spark debate over euthanasia and hospice care. Many reasons for legal suicide are for mercy. Diane Pretty was rejected the lawful option to pick the conditions of her own death. She experienced engine neuron infection and is encountering the crumbling of her body. She faces a demise that she accepts will involve insult and enduring, and surely can't kill herself. The court has denied her solicitation that her better half be permitted to support her. This choice might be reliable with a lawful point of reference, yet is ethically off base. That is the reason the law should be changed. Assume that Miss Pretty turned out to be forever and seriously uncouth because of cerebral harm, that her life was being supported by clinical innovation. On the off chance that her PCPs accepted that clinical treatment could give no profit in view of her powerlessness actually to take part in any self-coordinated movement, at that point, lawfully, they could pull out live, continuing medicines or incorporating hydration and nutrition. In such conditions, they would anticipate that she would pass away of their inability to perform what might actually be their obligation to ensure life and well-being. In most different conditions, doctors are not permitted this prudence to quicken predictable passings through inaction. So it is now and again worthy for specialists to stop life continuing medicines when there are justification for accepting that it is to the greatest advantage of seriously awkward patients. Similarly, activity and inaction might be esteemed ethically and lawfully equal with regards to an intention inability to complete the obligation of care to spare with life when clinicians concur that it should be spared. Consequently, Parliament and the courts should make the following stride of perceiving that this equivalent identicalness should hold when there is clinical understanding that is to the greatest advantage of some seriously uncouth patients to end their life. The most expressive adversaries of automatic, aloof, and dynamic killing acknowledge that there is no ethical contrast among commission and oversight and the clinical withdrawal of life fundamental level. Notwithstanding, they do not contend that to be satisfactory, such non-arrangement must satisfy two conditions: that standard automatic willful extermination in practice. Obviously, any intelligible supporter of dynamic willful extermination and doctor-helped self-destruction must pay attention to the issue of elusive inclines of choosing when a solicitation for helping by killing is fitting. In spite of the fact that this might be troublesome, it can't be incomprehensible. The main inquiry stays, notwithstanding so much good right, where is some unacceptable? Thank you.